Unintentional injury is the leading cause of death in children over 1 year of age. Unintentional injury causes multiple deaths every year in the United States. And out of unintentional injury, the different causes include transportation injuries, which are number one, and number two is drownings, which we see a large number of in Rhode Island. Between 2010 and 2013, there were about 30 deaths in children from drowning, which is about the size of a classroom in Rhode Island. Drowning is defined as suffocation, which results from some sort of water or other liquid substance. In the state of Massachusetts, there were actually 200 drowning deaths in the past 3 years. And in the country, there were 5,000 drowning deaths in the past year. So it's something that's very prevalent, and we do see it here in the emergency department. Although drowning is one of the most prevalent injuries that we see, it is something that's preventable, and there are multiple ways to prevent it. One of the most important ways is with swim lessons. So it's been shown that children, especially over 1 year of age, if they have swim lessons, it decreases the prevalence of drowning by a significant amount. It's very important for families to have swim lessons together. And it's also important just to remember that if a child has had swim lessons and has the basic skills for swimming, although it is protective, there are other things that are important for keeping them safe. Those other things include having someone who's within arm's length for smaller children while they're in the water. It's having someone who is always watching the children, whether it be a lifeguard or another responsible adult, and preferably for that adult to actually be familiar with CPR as well. The other thing that's important in terms of pool safety is having a fence around the pool. So if you have a pool at your home, it's important to have a 4-foot high fence around 4 sides of the pool. So that includes the side that's closest to the home to really protect the child from going out when no one is aware and falling into the pool. And that's important even for younger children who may know how to swim, who could get caught under pool covers or things like that. So if a child appears to be drowning, the most important thing is to remove the child from the water and put them on a hard surface immediately. Then you want to look and see if they appear to be breathing. If they're breathing, then you can go and get help. If they're not breathing, you want to see if they're responsive. Are you okay? If they're not responding and they don't look like they're breathing, then you want to go ahead and start chest compressions. I'll demonstrate chest compressions here, but it's important for you to look for your local Red Cross or to look online to find CPR courses so that you can learn CPR yourself. If the child does not appear to be breathing and is not responsive, then you should start chest compressions. Those chest compressions should be in the middle of the chest over the breastbone or sternum. They should not be lower down at the xiphoid process, which is the base of the ribs here, and they should not be up at the top. It should be right in the middle. You put your hands right in the middle here, and you're going to push fast and push hard. And you should be pushing the chest almost a third of the diameter in so that it's really squeezing the heart and allowing the heart to push the blood out to the rest of the body. So here's a demonstration. You also want to be sure that you're standing right over the chest so that your arms are going straight down when you're pushing down so that you're really effectively squeezing the heart well. Now, if you're by yourself, you're going to do 30 compressions and 2 breaths. If you have someone else with you, then it'll be 15 compressions to 2 breaths. When you're doing mouth to mouth, if it's a younger child, it'll actually be mouth to nose. And you want to make sure that your mouth completely covers their mouth and nose. If it's an older child, it's just mouth to mouth, and you want to just make sure that your mouth is completely covering their mouth. When you're giving those 2 breaths, you're giving them slowly, and you're making sure that you actually see the chest rise a little bit, which is showing that the lungs are expanding as you're giving the breath. Each time that you do the compressions to the breaths, that's considered one cycle or one time. And so you want to do that for 5 rounds to make it a full cycle, which means you do the chest compressions and the breath, that's 1. You do that for 5 times to make it 1 full cycle. And after that cycle, if the child is still not responding and no one has come for help, at that time you can call for help. It's very important to supervise your kids closely when they're in any body of water. Drowning usually does not look the way it does in the movies. So in the movies, there can be flailing and screaming and lots of activity. And most of the time, it does not look that way in real life. Drowning can be a very quiet, very subtle thing. And so it's important to have your eyes on each child who's in the water. And if you don't see that child for a couple seconds, it takes less than a minute for a child to drown. So it's very important to be vigilant and to really watch and make sure that the child is above the water and is safe. To learn more about drowning and keeping your children safe during the summer, visit forsafety.org.